Hello, everyone. Good evening. I hope all of you are having a fantastic day so far. Uh, my name is Pramod Varma. It's wonderful to be here, saying few words about uh, what we have been overall India's digital journey and how HCX fits in extremely well into that journey, and how all of you can make a huge difference as we digitize the underlying systems. So we should take a step back and understand how India has been systematically building up our digital public infrastructure. Digital public infrastructure simply means, think of them as digital highways or railroads. They by themselves don't do anything unless there is economic activities on those highways, typically done by the marketplace and consumers and so on. But the government lays it as a public utility, right? So similar to that, when the entire society goes digital, it is essential that digital infrastructure has been also created to provide equity and opportunities, affordability, access, and so on. So because the gap of people who have and people who don't have cannot be so wide that it creates social unrest. So it's very important that we keep doing that. And the journey in India, we started with Aadhaar. Digital identity is essential to create digital trust and digital empowerment to individuals as well. So the individual's ability to prove who they are in a consistent and systematic fashion. That's what Aadhaar pretty much did. And it was an extremely minimal system. It was an extremely simple system in one sense, huge at scale, but the overall capabilities, it does one thing really well. So we use these terms, Lego blocks and so on, right? So you should consider digital public infrastructure such as Aadhaar or DigiLocker or UPI, all as a set of building blocks. They themselves by itself does not do anything, but when it gets adopted by many of you as entrepreneurs or adopted by the government or the market and by this, anyone else as an adoption agency adopts it and provide value to the individual, then it becomes meaningful. So it was essential that we always look at value unlocking through this digital building block, not just create this building block from a supply side activities. From a demand side, you have to remember, why would people want to use it? Why should banks want to use Aadhaar? What is their incentives? And how do we create adoption to unlock value for 1 billion people? And we started that with Aadhaar, but then we went on to build e-sign as a digital signature capability, DigiLocker as a mechanism to create trustworthy, high trust, low cost, credentialing environment. So all the certificates and credentials that you get, whether you are an SME or an individual, individuals get credentials like academic credentials. Maybe you are a sportsman and you get that. Maybe you are an artist and you get all those credentials that you accumulate over time. You also get healthcare credentials. And interestingly, with COVID, we created vaccination credentials for everyone, right? So it is important that we ensure the credentials are converted to digital credentials, digitally verifiable credentials, and given back to the individual. This is the essence. So we have to keep doing that systematically everywhere, whether it's in education and skilling, whether it's in SMEs, for example, trade certificates, their licenses. Small business will have to obtain many licenses in the country to perform their business. All those are all today. Much of that is in paper, and paper is not trustworthy. So then the cost of trust is very high when you leave it in a paper world. So DigiLocker was in essence to unlock that convert paper into digitally verifiable means. Does not mean you can't print out. It's like COVID certificate, you can continue to print it out, or Aadhaar card, you can continue to print it out. But the digitally signed QR codes in Aadhaar or COVID certificate or in any academic certificates and so on becomes the means for you or for an SME or for any individual to be able to prove something in a high trust, low cost fashion. So we did DigiLocker, and of course, then we did UPI. And I don't have to talk about UPI to you. If you are living in India and if you have not used UPI, I'd be very, very surprised. I'd be curious as well. Why not? But UPI transformed the ability to move money from any bank to any bank, any bank to any wallet to any bank, between merchant and people, between people and people. And the essence of UPI was a protocol. Remember that term. Essence of UPI was an open protocol that allowed high trust, instant moving of money. It did not even have, UPI does not even have assumption that it is only for rupee. It does not make assumption that it is smartphone and so on. So it was designed a very well protocol. And then of course, we built the policies around that, and then brought the entire ecosystem around that to take us to nearly 8 billion transactions a month. And it's, all of us should be so proud in India that we managed to do that. But if you look at that, we did not stop what we call India stack, right? They were all horizontal building blocks: identity, e-sign, DigiLocker, UPI. We're all horizontal. That means it has no domain purpose by itself. But then we subsequently went and started building health stack and education and skilling stack, and now agriculture and of course commerce stack as well, right? We are doing a bunch of things in India. What again, going back to that essence of building digital public infrastructure, such as digital highways and like internet and GPS, something that is minimal, that ensures interoperability, it ensures high trust, it ensures efficiency in the system, but it only a very, very simple minimal rails. On top of that rail, entrepreneur like you or hospitals or many entities which are leveraging that can leverage it to provide affordable and accessible services to everyone. And that's sort of the repeating that essence of that. And ABDM, I'm very sure you're going to have brilliant discussions around that as well. ABDM is a layer above India stack that reimagined what are those building blocks in the health and wellness sector that will allow many of you to further innovate and create a level playing field that allows all of you to innovate rapidly towards affordable, accessible healthcare and wellness solutions for 1 billion people, right? And that's not easy. And you need to think about diversity. You need to think about that scale. You need to think about all that thing, which is why by stack itself is only one portion of it. And when you do stack, doesn't mean you will sort of automatically happen. Many of you have to rise up to the challenge of building solutions to provide that efficiency, provide low cost, high trust, affordable, accessible solutions to entities in the sector like insurance companies, insurance providers, healthcare hospitals, small boutique healthcare clinics, individual doctors, and of course patients. Many and all individuals. Why? Wellness is nothing to do with patients per se. Now, a lot of people ask this question to me. Actually, I just want to take a minute saying that by digitizing, creating a digital highway and creating digital solution, would that solve our wellness and healthcare issues in the country? Frankly, I don't know. I'm optimistic it solves to some level, but it's like asking. I think once Henry Ford, made a statement that the only thing worse than training your employees and having them leave is not to train them and having them stay. And that's an important, remember, that's an important thing, because it tells you that these are necessary conditions we must do, but not sufficient to solve a larger societal challenges. We find, people who have money and people who have good education still unhealthy, right? Having habits. So there's much more to do to create a societal level healthy society. But not doing it, not creating the Lego blocks, and not creating efficiency, not creating affordability and accessibility is definitely a death knell for at a large 1 billion population. So remember, what you're doing is towards creating that necessary impetus, but not sufficient, and then so that affordable, accessible healthcare comes to everyone, awareness comes to everyone, knowledge comes to everyone, and most importantly, they have the agency to choose what they want to do. But after that, will they choose to be healthy? It's something that we have to work on as a society, right? And this one thing that we started doing, and I talked about UPI protocol, is to think of a network driven by protocol, to a network of providers to bring this efficiency in the system and affordability and accessibility in the system. And UPI did that with payment. ONDC, if you look at our commerce infrastructure, is not a platform. ONDC, UPI is not a platform. UPI is a network. ONDC is not a platform. ONDC is a network powered by the underlying protocol called Beacon protocol, right? It allows logistics and commerce and services to be bought and sold and so on a large network, but a unified network through protocol. And what you're doing in HCX, and this is the first of such events I hear, I am very, very excited about the community, HCX community, and what you're doing with HCX. I've been fondly watching the work of Swasthalines and all of you in the community to build up this HCX protocol. But this one protocol can create very, very large network effects, which is what we saw in UPI and which is what we're going to see in ONDC. We are going to see a network effect coming through protocol approach. Protocol provides uniformity, interoperability, but allows you to really create innovations that allow auto adjudication solutions, workflow solutions, and much more to be imagined. Why do we need it? Again, go back to the fundamental. High trust, low cost, affordable, accessible services and products and services to people. To achieve that, you need underlying data to be digitized, identities and registries to be digitized, but most importantly, transactions to be digitized. But transaction digitization is not by necessarily writing one platform and one portal. It's about creating that digitization protocol that allows all of you to build brilliant innovations on top of that. So I wish all of you all the very best. Have a fantastic evening, and I look forward to seeing HCX come alive and a thriving HCX community, and hopefully HCX going global. Congratulations once again. Bye-bye.